Nowadays, we see the label gluten-free everywhere, on supermarket shelves, in restaurant menus, even on products where we never used to think about gluten. But is this really beneficial for everyone? Let's take a closer, scientific look and separate fact from myth. Gluten, also known as wheat gluten or gliadin proteins, is a group of proteins found in wheat, rye, barley, and oats. The most important among them are gliadin, secalin, hordein, and avenin. For most people, these proteins are harmless, they are digested and absorbed in the small intestine. But in certain conditions, gluten becomes a serious problem. And gluten isn't only in bread or pasta. It's hidden in many processed foods, ketchup and sauces, mayonnaise, ice cream, sausages and hot dogs, some dairy products, alcoholic beverages, chips, ready-made spice mixes, fast food, and sweets. There are three main medical conditions where a gluten-free diet is absolutely necessary. The first is celiac disease. This is a genetic autoimmune condition in which even the smallest amount of gluten causes inflammation and atrophy of the lining of the small intestine. Symptoms may include frequent loose, foamy, oily stools with undigested food, abdominal pain and bloating, nausea, unexplained weight loss, frequent bone fractures, osteoporosis, anemia and vitamin deficiencies, weakness, irritability, depression. In women, delayed menstruation, infertility, or recurrent miscarriages. Tooth decay, brittle bones. Neurological symptoms such as headaches or balance disorders. Celiac disease often develops in childhood, but it can sometimes be diagnosed later, between ages 25 and 40. The most accurate diagnostic tests are serological blood tests, looking for antibodies to tissue transglutaminase, endomysium, or deamidated gliadin peptides. The gold standard remains endoscopy with a biopsy of the duodenum. DNA testing can also support the diagnosis. The only treatment is a strict, lifelong gluten-free diet. The second condition is gluten intolerance, also called non-celiac gluten sensitivity. Symptoms may resemble celiac disease, abdominal pain, diarrhea, bloating, fatigue. But in this case, there is no intestinal damage and no specific antibodies. For these patients, eliminating gluten often leads to a significant improvement in symptoms. The exact reasons for this are still being studied. The third condition is gluten allergy. This comes with classic allergic symptoms: skin rash or hives, runny or stuffy nose, sneezing, difficulty breathing, swelling of the lips or face, angioedema, asthma attacks. Here again, a gluten-free diet is the only effective treatment. Now, the important question: should you go gluten-free if you are otherwise healthy? So far, there is no scientific evidence that a gluten-free diet benefits people without these diagnoses. In fact, removing gluten-containing grains from your diet can deprive you of fiber, B vitamins, iron, zinc, and other essential nutrients. What's more, many gluten-free products contain added sugar, fat, preservatives, and thickeners, which may harm your health rather than improve it. So the rule is simple: a gluten-free diet is not a lifestyle trend or a weight loss tool, it is a form of medical therapy. It should be prescribed and supervised by a gastroenterologist or dietitian after proper diagnosis. If you are healthy, whole grains that contain gluten are not only safe, they are an important part of a balanced diet. Now I want to hear from you. Have you ever tried a gluten-free diet? Did you feel any difference? Share your experience in the comments, it might help others. And if you still have questions about gut health, leave them below and I'll be happy to answer. This is your Gut Health MD. Subscribe to the channel for reliable, science-based knowledge about digestive health. Remember, take care of your gut, and it will take care of you.